Hello everyone. Today we will discuss about the ankylosing spondylitis. So it is characterized by chronic inflammation and affect the younger adult male, that is 15 to 35 years of age group. It is also known as Mary-Strumple disease or Bachelor disease. The patient complained with clinical features of chronic low backache. Genetics play a role in its pathology and it usually affects the anthesis of the axial skeleton. Anthesis is basically the junction between the fibrous and bony tissue. The main target site is the sacroiliac joint, and the diagnostic projection is AP or PA angulated spot views. There will be bilateral and symmetric involvement of the SI joint. We need to know that the SI joint contains three types of joint. In the upper part, it is the syndesmosis. In the middle part, it is symphysis, and in the lower third part, it is synovial joint. So let us see a X-ray of ankylosing spondylitis. So here we can clearly see there are erosions and associated reactive sclerosis. So here we can see the erosions and the reactive sclerosis. And the lower 2/3 of SI joint is usually involved. Why we have learned? Because it contains the synovial joint, and the ankylosing spondylitis, that is the AS, it commonly involves the synovial joint. Also, the iliac side of SI joint is more involved than the sacral side. Why? Because the hyaline cartilage on the sacrum is 3 times thicker than the ilium side, so it is protected. Now let us see the Forestier classification. There is three grades of Forestier classification. First is the pseudo widening, erosions, and the ankylosis. In the pseudo widening, it occurs due to the subchondral osteoporosis. There will be hazy joint definition. Here we can see in the picture there is pseudo widening of the joint. In X-ray also we can appreciate the pseudo widening. In the second stage, that is the erosions and sclerosis. Due to the erosion and sclerosis, there will be rosary bead appearance, and it is the most common stage in which the diagnosis is made. Here in the picture we can see there is this rosary bead appearance. Again on the X-ray we can appreciate there is this rosary bead appearance. Finally, there will be obliteration of the joint space, that is the ankylosis. Here we can see this is the ankylosis. Now let us see the other radiological features that we observe in the ankylosing spondylitis. So first is the formation of marginal syndesmophyte. So what are syndesmophyte? These are ossifications of the spinal ligament. Here we can see these are the syndesmocyte formation. We will learn about the difference between syndesmophyte and osteophyte in the coming slide. Now next we will see the Romanus lesion and the shiny corner sign. So focus on the picture. On the left hand side we can see there is this erosion on the anterior superior part of the vertebral body. This erosion is known as this Romanus lesion. And we also appreciate there is this reactive sclerosis around this Romanus lesion. So this surrounding sclerosis is known as shiny corner sign. Now let us see some other changes in the spine. Observe the anterior part of the vertebral body. If there is this loss of concavity in the anterior part, this is known as the squared vertebra. And if this anterior part of vertebral body becomes somewhat convex, then it is the barrel shaped vertebra. And we have discussed that there can be formation of syndesmophyte, which are thin, vertical in direction, and occurs due to ossification of annulus fibrosus. Now let us see the difference between the marginal syndesmophyte and the osteophyte. So the syndesmophyte are thin, vertical, and seen in the ankylosing spondylitis. So here we see this is the syndesmophyte, which is thin and vertical. On the other hand side, The osteophytes are thicker, more horizontal, and seen in the degenerative joint disease. Here we can see these are the formation of osteophyte. We can also see in the X-ray, these are the syndesmophyte and these are the osteophyte formation. Now there can be formation of bamboo spine. In bamboo spine, what occurs is that there will be complete interbody fusion, that is the ankylosis, due to the marginal syndesmophyte, and it gives the spine a undulated contour, that is in the form of waves. Here focus on the X-ray, we can see there is this undulating contour of the spine. In the lateral part also we can see the marginal syndesmocyte formation, which gives to the bamboo spine appearance. Also, we can see whiskering. Whiskering is basically a type of parietal newborn formation. It is fluffy, irregular and spiculated in the ankylosing spondylitis. Similar picture is seen in the psoriasis as well as Ritter disease. Now in the X-ray we can see this is the irregular whiskering reaction of the bilateral ischium. So this is known as whiskering. Now finally the last two sign. The trolley track sign is basically ossification at the central part as well as the lateral part of the vertebral body. In the center it will be due to the ossification of interspinous and supraspinous ligament, and in the lateral part it will be due to facet joint capsule and ligamentum flavor calcification. We can see there is ossification in the central part as well as two lateral lines. So this is the trolley track sign. And in the dagger sign, the ossification only occurs at the center due to the involvement of supraspinous and the interspinous ligament. So this is all for the ankylosing spondylitis. If you like the video, do subscribe and comment.